Hello, my name is Sarah Stansbury, and I'm an intern at Geisinger presenting my summer research titled From MyCode to ClinVar, publicly sharing variants identified in Geisinger's Biobank. MyCode is a biobank open to Geisinger patients where participants submit samples which undergo genomic analysis. The data provided through MyCode can contribute to genetic research, and clinically actionable genetic variants are returned to patients to inform their care. Over 200,000 samples have been provided to date. Making genomic findings publicly available ensures that researchers and clinicians can learn from this data and better understand how a given variant impacts health. Although MyCode has published papers listing variants identified through the study, conventional searching methods can miss variants since they are often included in supplemental material. This introduces the need for a centralized, publicly accessible resource. Addressing this need, NCBI's ClinVar is a public database of variants and their classifications. With the importance of data sharing in mind, this project aims to submit MyCode variants reported in the literature to ClinVar. Available MyCode publications were reviewed for reported variants. We were only interested in variants that we could confirm were identified in the MyCode cohort, and so variants reported in multiple biobanks in aggregate were excluded. Information needed for ClinVar submissions was collected from the publications, and appropriate variant nomenclature was confirmed. All variants identified will be submitted to ClinVar. If a variant had an existing ClinVar record, its reported classification was documented to assess the potential impact of a MyCode ClinVar submission. From 60 publications, 16 had shareable variants, supplying over 1,000 variants suitable for ClinVar. So far, we've searched 975 in ClinVar and found that 462, or 47%, are new to ClinVar, showing such data sharing contributes new variants that haven't been publicly shared previously. 513 variants have been previously shared, but even though these have been seen before, there's still utility in sharing these variants. Of the variants that have been previously reported, 64% are pathogenic or likely pathogenic, 20% are of uncertain significance, and 15% have an inconsistent classification, meaning that submitters have concluded different classifications for the same variant. Sharing MyCode data with ClinVar could improve our understanding of these variants. As 462 variants were novel to ClinVar, and a third of the previously reported variants had uncertain or inconsistent classifications, this project shows that data sharing really is necessary. Next, we are finishing reviewing variants pulled thus far and preparing them for submission to ClinVar. We would also like to start a dialogue about what other MyCode variants might be useful and appropriate to share. My hope is that as data sharing efforts like this strengthen, genetic test results will become clearer, leading to an improved standard of patient care.